Can the disease be prevented with early detection?
Well, fatty liver is very common. In fact, it's estimated that 1 in 4 of the adult Malaysian population has fatty liver. Okay, and in general, the reason for fatty liver is because of obesity. It's a lifestyle problem. So to answer to your question, fatty liver can actually be prevented. We don't even need to say to detect early. It's really by having a healthy lifestyle, eat healthily, be active, and maintain an ideal body weight. That itself would help prevent fatty liver.
Back to Dr. Jaya, can you please shed some light on how endocrinology is linked to fatty liver disease?
Yeah, so as I actually alluded earlier on, because endocrinology involves treating patients who have obesity, being overweight or diabetes. So the main driver for fatty liver is actually this problem called insulin resistance. That actually basically means your body can't use insulin, although there's enough or maybe too much insulin in the body, but the insulin can't be used properly because there's resistance that's driven by being overweight or having diabetes. So because of that, there's abnormal fat accumulation that happens in the liver, and that actually leads to fatty liver. That's the main play in which endocrinology comes into in terms of fatty liver. So it's actually, although it's at the end the target is in the liver, but actually the main driver is an endocrine disorder, which is insulin resistance or from obesity or from diabetes.
Doctors, fatty liver is also described as a lifestyle disease. How would diet relate to fatty liver, and how does the disease affect one's lifestyle?
So as mentioned before, the reason for fatty liver in the majority of case is because of chronic overnutrition. So people are simply eating more than they need. And what happens is our daily energy requirement will gradually increase from the time that we are a child until we are young adult. And from there it plateaus, and as we move to middle age and older age, the energy requirement actually slowly goes down. But in a lot of people, they continue to eat the amount that they used to eat when they were younger. Okay, and they tend to have excess of energy. Okay, and especially once a person, for example, start working or have a family, they will have less time for physical activity. And depending on the job, a lot of people tend to be more sedentary, and the energy requirement actually goes down. But yet, the energy intake is similar, if not more, than what it used to be. And all this excess energy will be stored in the body as fat, and contributing to central obesity, an increase in the waistline, contributing to accumulation of the fat in the liver, leading to fatty liver, as well as leading to all the other diseases which Dr. Jaya has mentioned earlier: diabetes mellitus, hypertension, dyslipidemia, all of which are risk factor for cardiovascular disease.
What would you recommend the best diet to avoid fatty liver?
Well, so generally what I'll tell my patient is that, for example, if they are going to have a meal on a plate, they should fill half of the plate with vegetables. So vegetables fill the stomach, it makes them feel full, but it has a low amount of calorie. And perhaps a quarter of the plate will be carbohydrate, and a quarter of the plate will be protein. So for carbohydrate, carbohydrate that releases sugar slower, for example, brown rice or wholemeal bread, would generally be better than white rice or white bread. Whereas for protein, egg or fish will be healthier than meat. But if the patient prefers to take meat, then it should be lean meat instead of fatty meat. And the method of cooking is also important. So for example, a steamed food or soup-based food will be healthier than deep-fried food. I'm not sure what Dr. Jaya thinks about
Yeah,
that.
so I think I completely agree with Prof. Chan. There is a saying that goes suku setengah in Malay, and that's actually promoted by the Ministry of Health. So that actually means a quarter of carbohydrate, a quarter of protein, and the other half vegetables basically on your plate. And that's a standard size plate, not a huge plate like that. And then of course, content-wise itself, I mean specifically for fatty liver, I suppose you should reduce saturated fat, as well as reduce a lot of, fructose, things that come from sweets, soft drinks, all that is definitely a big no-no in terms of fatty liver. starch content have to come down as well, carbs as well, and calories.
Yeah, one of the thing that I found helpful to patients is to actually cut off taking sweet drinks. Once they have fatty liver, and especially if they have diabetes mellitus. So one of the things that I tell patients would be to cut off sweet drinks completely, because you'll be surprised, a lot of these patients, although they have diabetes mellitus, they still continue to consume a lot of sweet drinks, teh tarik, and in fact even soft drinks. And that actually makes matter worse, a lot more difficult to control the diabetes. So just by cutting off sweet drinks and taking more water itself can actually cut away a lot of calories and help with the condition that they have.
Here we're talking about non-alcoholic fatty liver. What about those who consume alcohol?
Yes. So, in fact, the reason it's called non-alcoholic fatty liver disease is because in the past, whenever a person has fatty liver, many years ago, whenever a person has fatty liver, it's assumed to be due to alcohol. Okay, because we know alcohol can cause fatty liver disease. But back in 1980s, one of the clinicians actually noticed that there are also a lot of patients who don't actually consume alcohol, but yet they have fatty liver disease. And what they found in common in these patients are that they are obese, okay, and they have other diseases like diabetes mellitus, hypertension, and high cholesterol. Okay, and that's how they coined the term non-alcoholic fatty liver disease, and which for quite a while encompasses a lot of conditions which contributes to fatty liver, for example, certain medication and so on. But we know by far the most common reason is really chronic overnutrition, leading to what we call non-alcoholic fatty liver disease.
Yeah, so along the same lines, I mean, I completely agree with Prof. Chan, and I've even heard experts say that, you know, a soft drink is almost as hazardous as alcohol to your liver. So if you don't take alcohol but you take soft drinks, that's the equal kind of injury you are doing to your liver in terms of getting fatty liver, and that's definitely true, because diet which is high in sugar, high in fructose, actually fuels fatty liver. The same way, sort of the same way alcohol actually damages the liver as well.
Dr. Chan, Dr. Jaya, has fatty liver disease reached an epidemic stage in Malaysia?
I would certainly say so. When 1/4 of your adult population has the disease, I would consider that as an epidemic. So in a recent study that we conducted in a medical facility whereby people came for health checkup, we found that nearly 25% of these people who were apparently healthy actually had fatty liver. And in certain population, the prevalence of fatty liver is even higher. For example, in the diabetes clinic where Dr. Jaya works, we have found that as high as 70%, that means 7 out of 10 people who are attending the clinic has fatty liver. Generally speaking, fatty liver increases with increasing age. Okay, as the person gets older, they tend to be more likely to have fatty liver as they become more obese. And in young adulthood and in middle age, fatty liver is more common in men compared to women. But as a woman reaches menopause, fatty liver will tend to catch up and be as common as in men.
Yeah, just to add to what Prof. Chan has said, although he said like 1 in 4, my feeling is that it actually might be higher than that, because as we have mentioned earlier, 1 in 2 Malaysians are overweight or obese, so that's actually about 15-16 million Malaysians. And if you look at the National Health and Morbidity Survey data from 2015, which is the latest one, about 4 million Malaysians have diabetes, type 2 diabetes. So I'm thinking it's going to be probably more than that 25% in the whole of the Malaysian population. It might even reach 40% or 50%. That's actually my feeling about what the prevalence is, and that definitely is an alarming epidemic kind of numbers that we should be really worried about.
Yes.
How would you explain that that fatty liver is a silent epidemic?
The reason is silent.
With reference to Malaysia.
Yeah. The reason we call it a silent epidemic is because it's so prevalent but yet not many people know about it. Okay, and patients do not tend to have symptoms. So there are many people walking around with fatty liver, as well as undiagnosed maybe diabetes, hypertension, and dyslipidemia. Okay, so it's silent. They do not exhibit any symptoms at all. So it is indeed a silent epidemic.
Yeah, just adding to that, just like how fatty liver itself is silent and most of the time patients don't have symptoms, even diabetes, if you look at the National Health and Morbidity Survey from 2015, 50% of that 17.5% of the Malaysian adults have had diabetes at that point, and 50% of them didn't even know until that survey was conducted that they had diabetes. So only through that survey they actually found out that they had diabetes. So a lot of this metabolic syndrome or diabetes, high blood pressure, cholesterol, or even fatty liver is actually all silent until it actually leads to complications, and bang, that's when patients are hit.
What does it all mean that, that people are not aware that they are having fatty liver, that the fact that it is a silent disease? They only know at an advanced stage, a later stage.
I think in terms of liver, we are actually seeing more and more patients being admitted now for complications of cirrhosis, and they were previously not diagnosed to have any liver disease before. So in the past, when we have patients who are admitted with complications of cirrhosis, where we will diagnose other causes of chronic liver disease like hepatitis B virus infection, hepatitis C virus infection, or there may be a history of alcohol consumption, because these are really the common causes of chronic liver disease in the past. But what we are seeing now is we are seeing less and less of this because we have effective treatment for hepatitis B. We are starting to have effective treatment for hepatitis C. We are seeing more and more patients presenting for the very first time with complications of cirrhosis, and we find that these patients in fact has fatty liver all along, which has previously not been diagnosed.